is the essence of this thing. They had a CMD in UCH at the time that was going around with police escorts. Does this still go around with police escorts now? When it's no longer CMD? And they were paying those people on a daily basis, apart from their salaries. They are paying their allowance. What's the meaning of all that? But you see, it's symptomatic of the society in which we operate. Every member of House of Assembly has one police orderly. We have 500,000 policemen. 250 are guarding our elite. 250 are guarding 200 million. You understand? So all this nonsense that people must, but people are not asking questions. People are not asking questions. People
so we really can't blame underfunding, or inefficiency.
Inefficiency.
I'm still trying to point out the inefficiency in what you're talking about now.
Yes, it is. And then we must deepen health insurance. Maybe we are a product of the British colonial system. Why don't we have health insurance? Why didn't we copy that one? That is what is sustaining that society. Health insurance is, Oyo State is doing, but it's not widespread enough. It's not widespread enough. People, we don't insure anything. We pray.
Maybe the awareness is not enough.
What awareness is not our thing. We pray. If you build a house, they say insure the house. God will protect it. God will protect it. What if the house get burnt? That's stupidity. It's outright stupidity. People don't insure their cars. Police is harassing people now just to insure their cars. My wife works in insurance, you understand? But it's the insurance companies too. They don't want to pay. But if you go to proper insurance, is health insurance. You know the meaning of insurance now. So if there is, that is preparing for. So we should deepen health insurance.
Now, before we leave this health issue now, there is this particular advice from medical experts saying that privatize specialist hospitals for greater efficiency. What is your take on that? That the specialist hospitals should be privatized. Maybe they should be taken away from the government's hands so that we can have better efficiency. Talking about inefficiency now.
You see, people forget that they call them teaching hospitals. That's why they call them teaching hospitals.
Because I told you that if UCH was a private-owned hospital, it wouldn't be in blackout for 107 days.
It won't be in blackout for 24 hours.
That is it. So that is why some people are suggesting that maybe these specialist hospitals should be privatized.
People should understand
for better efficiency.
The rationale for establishing it. They are called teaching hospitals. People should understand that. Just like when we were growing up, there were what do they call them? Teacher training colleges. There were what they call practicing schools attached to them, where the teachers that were being trained in those colleges had schools to practice. They do teaching practice. When you are in education, whether BSc or whatever, you do teaching practice. So those colleges had practicing schools. That is why they are called teaching hospitals for the colleges, for the colleges of medicine. That's why they're called teaching hospitals. So people should understand the rationale for their establishment before they start making calls like this. They are teaching hospitals.
Okay. For
clinicals. That is why when doctors come in the morning, you will find 8 of them standing by your bed. You think they are, of course they are doing ward rounds, but certainly they are doing their classes too. And of course, in ignorance, those who do not know, 8 doctors came to attend to me this morning. They are running their own class.
So if those institutions can be privatized, what will be a way out or way forward to avoid this embarrassing situations?
You see, the question is, you put people in places. What is their mandate?
See, I'm particular about this thing because it is believed that most of these government-owned establishments suffer. I know a particular radio station that when there's no NEPA, they won't put on the gen because they'll say they don't have fuel. And that station might be off air for days. Government owned. I don't want to make, but you hardly see that happening in privately owned radio stations. Because so it is believed that anything that has to do with the government, there's this attitude whether we do or not, or salary would drop.
Even if they buy diesel, if the diesel is 1,000 naira, you can be sure that they will add 20 naira per liter for the GM. Director of admin, 20 naira.
That is,
Chairman,
that
20 naira.
that is the general
So,
belief now that most things in government are lacking.
people don't care. People working in government, employees, as long as their salaries are paid, they don't think they have a stake.
That's why this suggestion is coming. Maybe they should be privatized.
No,
And put in the hands of
I think
of individuals
I
that can
think
fund.
you know the funny part. These tertiary facilities are now serving primary healthcare purposes. That's the fact. That is why people won't have to, you don't have complications. You just want to have a baby. Look, come on. Why are you going to? When we were growing up, you go to Jericho nursing home, not even a hospital. Jericho nursing home. That's where you will go. What am I going to do in UCH? So these are the challenges. We should strengthen the primary health care and then the general hospitals. But go to those primary health care facilities. Some are good, some of those primary health care, or just it has revamped virtually all the primary. But is it the business of the state? No, it is not. Leave these things in the hands of. But you see, the challenge is they will bring drugs there. These nurses and the aides, they will steal the drugs. I know these things because I have been. They will steal.
Some take these drugs to their own.
Because there will be no penalty. Because there's no. When they say good governance, I say I don't want good governance. I want transparency and accountability. That is what will give us the good governance.
All right, this is still from the Daily Zone Solutions and 93.9 FM.